So, the general idea here is that I've seen many practices that don't want to address this financial responsibility with patients. And I can tell you, I mean, that is a grave mistake because it causes really a few different issues. And the biggest issue is that if you've got to chase the patient on the backside, it is costly, and I can tell you that you're going to receive a lot less yield on each of your visits than you would had you not addressed this and faced it right up front. So, I mean, how do you do that? I mean, what's the motivating factor to really improving the financial health of your practice? And really, what it boils down to is that really two main things. I think it boils down to is that the first thing is that the folks that are in your office that are greeting those patients, those are some of the most important patients or the most important employees in the practice, and outside of the medical care, of course. But the reasoning is that I mean, it's like any other business. You go to a business, you want customer service, so you want to be greeted by a smiling face. You want to be welcomed. It's very important if you have the right outgoing person at the front desk that is greeting folks. And depending on the size of the office, it might be a different person on discharge. But depending on what your policy is and which route you decide to go as far as collecting money up front, it's getting money out of that patient with a smile on your face before they get back to the exam room. Assuming you go with a situation where, you say, well, look, the new patient's going to be 125, established patient's going to be 75. That's the rule. That's it. You don't get back to the exam room till you pay.